Hi there, I'm Mabel Jung, and you're watching the World Congress Executive Interview Zone, and we're so pleased that Neera Tanden can stop by. She is President, Center for American Progress. Thank you so much for being here.
Great to be with you.
Well, you were former Senior Advisor for Health Reform with HHS, and you were one of the people who helped write the Affordable Care Act. 6 years on, what are the obvious successes of that act?
I think the most important success is the number of people covered. We have 20 million Americans covered who have coverage because of the Affordable Care Act. People in the exchanges, Medicaid expansion. I think when you think about the challenges people are facing who don't have health insurance, the fact that 20 million Americans have that security is something I'm really proud of.
Okay, and some disappointments that you feel could have been avoided or things that you didn't foresee would happen?
I think one of the big challenges we have with the Affordable Care Act and what people call Obamacare is that so many people who have high health care costs, and has nothing to do with the ACA, employer-based coverage has really gone up, their deductibles have gone up. They can't divorce that from the ACA. So they think it's the ACA's fault that, even they work at a large company, their deductibles have gone up, 100%, 500% in the last 5 years. They sort of blame the ACA for that. I think that is a continuing challenge. We didn't address it in the ACA. It wasn't really part of the scope and purview of that. We assumed when national health care expenditures were moderated, consumers would benefit. That's really the next challenge we have to take up.
Now, are you encouraged by all of the scrambling to have dialogue for both payers and providers and everyone in the healthcare sector trying to get together to provide more efficient care? Is that encouraging?
It's, I think the incredible levels of innovation we've seen, throughout the country with payers, providers, doctors, nurses, systems, hospitals, has been incredible. I think a lot of people have looked at the ACA and looked at the broader healthcare system and said, we need to change. We need to figure out a way to get value for healthcare. We need to figure out how we're paying for things. That's really, I've been really impressed in some of our most expensive healthcare systems are thinking through new innovations. And some of the areas where we really need to have improvement of care are learning from different providers on how to do it.
How concerned are you that when we get a new president in the White House that all of that hard work will go away?
Well,
and that we'll backtrack on all the good stuff that has been done?
It really depends on who the next president is. So I think a Democratic president is likely to build on these successes. A Republican president, their stated positions in the campaign so far have been to eliminate the ACA, repeal the ACA. I think that would be, I obviously think that would be a terrible idea, but I also think you see more and more neutral analysis of it. Their Congressional Budget Office has shown that repealing the ACA would increase the deficit, in part because some of the downward pressure on healthcare costs really comes from the ACA. So, I'm hopeful that the debate around the ACA has really become less partisan, less polarizing. There's much less talk about it in 2016, negative talk about it than in 2012. Still a lot of Republicans take their shots, but Senator Sanders, obviously Secretary Clinton, will build on the ACA. Hillary herself has talked a lot about how to build on it and how to actually address these sets of challenges around healthcare costs going forward.
Now, speaking of costs, prescription care costs or prescription cost of prescriptions has been the most concerning aspect of healthcare in America. And you've done work on this at the center.
Yeah, so prescription drug costs are uniting Republicans, Democrats, Independents. People recognize that high prescription drug costs are a big challenge for national health expenditures. We've seen big inflation in that area. In fact, prescription drug costs are leading the entire healthcare sector, and you're seeing hospitals, insurers, employers all wondering what to do about it. So I think, you've even seen Donald Trump talk about join Hillary Clinton and Bernie Sanders and saying Medicare should negotiate drug prices, standing out for many Republicans on that topic. But I think he recognizes that, in fact, in a recent poll, Republicans, their higher priority is addressing prescription drug costs than repealing the ACA. So I'm hopeful that in this dialogue we have in a general election that you'll see some bipartisan interest. Now, I think Democrats are better able to solve these problems. They have more robust ideas on how to address these challenges. But the fact that we're talking about these issues is a real sign that they're deeply concerning to people at a time where wages have been really stuck. It's harder and harder to afford some of these really high healthcare costs.
What's the position of your center now? Are you getting ready for whomever is in the White House, and what happens?
Well, we've offered ideas on prescription drug costs. I should say that's a good example where we've talked about comparative effectiveness research, really providing information on prescription drug costs. We've talked about incentivizing pharmaceutical companies to invest more in research, do a lot less in marketing, which is really jacking up the price. Most pharmaceutical companies are still spending more on marketing than research. That seems really screwed up to us, just to be frank. Our focus over the last 2 years has been on providing ideas to every candidate on what to do in healthcare and other issues. We've offered ideas on high healthcare costs for employers and employees, the high expend for folks, and we've also had ideas on pharmaceutical costs. So we're prepared either way. I do think on healthcare, if we really want to build on the success we've had over the last couple of years, there's really one side that would be better at that.
Okay, and my final question, Neera, what's it like addressing an audience like this? What kind of message can you get out to people here in a forum like this?
Well, this is, the Healthcare Congress has always been one or I should say the World Health Congress has always been one that really attracts people, the leaders of the entire healthcare sector. So it's a great format to talk with leaders from all sides of the healthcare coin, consumer advocates, hospitals, doctors, but it's also a great avenue to hear what their concerns are. I think it's really important for policymakers to kind of hear the perspective of people who are really working on these issues day to day, trying to make healthcare work for Americans.
All right, Neera Tanden, thank you so much for your time today.
Thanks for having me.
And I'm Mabel Jong. Thanks for watching.